Osborne Zone. We're here to answer your nutritional questions. We did a crash course on blood pressure on Tuesday. If you didn't see that, I'd highly encourage you to go watch that course. It's very informative and potentially life-changing for you, especially if you struggle with blood pressure. But today I'm going to be answering your questions, largely your questions about blood pressure issues. So let's dive in. If you've got questions, pipe those into the feed, and I'll do my best in the next hour or so to answer as many as I can. Let's see here. Nellie says, greetings from LDN. Both my parents are in their 80s, so I'm here to learn so I can be better use at them. My mother's on calcium channel blocker. What's the fastest and safe way of lowering blood pressure once it's very high? And what is very high? So the fastest and safest way to lower blood pressure is to figure out what's causing it. I mean, ultimately, blood pressure is multifactorial. There's not one only trigger. A person could have high blood pressure over, what we discussed earlier. A magnesium deficiency can cause high blood pressure. Vitamin B1, calcium deficiency, omega-3 fatty acid deficiency. High processed diets can cause elevated blood pressure. Arginine deficit can cause blood pressure problems. Eating ultra-processed food and hydrogenated fat are major drivers of blood pressure. So ultimately, you want to have a comprehensive approach. And the quickest way to go about doing that is to be realistic about what needs to be changed. And a lot of people are resistant to that change. And this is true also of our parents. Sometimes our parents have been eating the way they've been eating. They've been doing things the way they've been doing. And they're in that situation because their history and their past has led them to that health deterioration. So they have to be willing to change. You can want them to change, but that's not enough. They have to be willing and wanting to change even at 80. So the quickest way is to determine what's driving it. For most, it's a combination of diet, lack of activity, lack of sunshine, lack of sleep, coupled with nutritional deficits. Those are the overview of what will lower it the best, is figuring and determining those things out. The calcium channel blocker in and of itself will manage blood pressure, but it's not going to fix it. And it's going to come at a consequence. Those medications deplete things like CoQ10 and zinc. And CoQ10 and zinc deficiency can also contribute to high blood pressure. So you kind of end up chasing your tail in that regard. As far as what's considered very high, it's a subjective question. I mean, high blood pressure, technically, if we're talking about the formal diagnosis made, it's any blood pressure over 140 on the top on the systolic number, and it's above 90 on the bottom, or what's known as the diastolic number. But when people really, in my opinion, start getting in trouble, so when that top number is really pushing above 170, and that's at rest, not after activity, because the top number changes with activity. And that bottom number is staying really above 100, 110, somewhere in that neighborhood or higher. Now you're running a much greater risk of increased vascular incidence. So anyway, I know that doesn't solve your equation for a quick simple, but there isn't a quick simple. Blood pressure is not a quick simple thing. It's an outcome of years of self-neglect and abuse. Despite whether or not your parents believe they were self-neglecting or abusing, that's what it is. It's why blood pressure goes south. It's because people don't take care of themselves at the end of the day. And sometimes they think they're taking care of themselves, but in reality, they're doing things that are not congruent to their own health. And this is why there's no one size fits all. This is the problem in mainstream medicine. You can't apply everybody with X disease gets Y treatment, because disease is multifactorial, and what's right for one is not necessarily right for another. I've seen cases of blood pressure elevations over broccoli or over other healthy foods that are adrenaline triggers for that person or allergy triggers for that person. And so those are things that can drive up blood pressure too. And again, one man's food is another man's poison. So determining those things is important. Okay. Why is low blood pressure not a problem? I've had a blood pressure of 87/52, drooling, slumped in chair, and text, amazed how great my vitals were, asked if I was a marathon runner, thyroid labs are fine, adrenals ignored. Lower blood pressure for a lot of people can be dehydration and electrolyte imbalance, lack of activity or lack of physical muscle mass. Those are really common things that can drive blood pressure down. I don't know if you've entertained those issues. There's also nutrients, calcium, although calcium deficiency can cause elevations in blood pressure, it can also cause drops in blood pressure as well. So there's some dichotomy to some nutrients and how they can impact blood pressure. So all those are going to be important. And okay, so following up to that question, and some people just have low blood pressure, but they're fine. They don't have low energy. They don't have health issues per se. My own blood pressure is pretty low. I mean, the top number usually at rest somewhere around upper 90s to low hundreds, and then the bottom numbers typically in the mid 50s, sometimes even lower. But I think part of it depends on the health of the person, the physical fitness level of the person. So let's see. I have for every slender, sunshine-loving vegan friend on a gluten-free diet, what dietary deficiencies would you consider with a new osteoporosis diagnosis? If she's got osteoporosis as a diagnosis, the bigger question would be, how was it diagnosed? Because most osteoporosis is diagnosed through DEXA scans. DEXA scans are not great tools to assess the health of bone. They're fine as far as, one measurement. DEXA scans measure X-ray absorption by bones, and then compare that X-ray absorption to in both age-matched controls as well as women who are about 35 years of age, as a general rule of thumb. But that how well your bone absorbs X-ray is not a determinant for whether or not you actually have bone loss, because you might have genetically a smaller frame. You might, African Americans have much denser bones than Caucasian people, and that's a proven scientific fact. So there's variance in how we would look at what osteoporosis and how osteoporosis should be diagnosed. But today, in my opinion, it's improperly diagnosed with the use of a DEXA scan as the sole means to determine bone density. I think DEXAs are fine, but you need to take those into context with also doing X-rays, where you can look at the lines in bone, and you can look at the trabecular patterns and the thickness of the bone on plain film radiography. I think it's also important that you look at markers like deoxypyridinoline that measure bone turnover speed, how fast bone is breaking down versus how fast it's being rebuilt. I think it's important to measure vitamins and minerals and protein intake, because if you understand all of those things, then about a person, and if their bone mass is low, maybe it's because they're malnourished, but they're not so malnourished. They're in the hospital, they're just malnourished, and their bone doesn't get what it needs to maintain its integrity. So all that has to be looked at. So I know that's a caveat to the question you asked. If you're talking about just a simple tip, what can you recommend a vegan friend who loves sunshine but has osteoporosis as a diagnosis based on a DEXA scan? You can recommend that they make sure they're getting enough protein. Typically, vegan diets are lower in protein, and protein is the matrix by which bone is mineralized. You can't make good bone without adequate protein. So I definitely, that would be kind of the low-hanging fruit of what I would have a conversation with her about. Love this. Dahlia says, left my GI doctor. She got aggressive when I stopped biologics and the colonoscopy. Exaggerated my results out of anger. I'm healing on no grain, no pain. Should I report her or let it go? I mean, in my opinion, I just let it go. She's ignorant, and that doesn't give her the excuse to be aggressive with you, and it doesn't resolve, the way that she treated you. But what's it going to accomplish if you report her? The fact of the matter is, if you know the way that politics works on the back half of medical boards, most reports go ignored. A lot of them go ignored, unless they're fake reports. I mean, we see a lot of really great doctors getting reported to their boards for for things that were perfectly fine, and it wasn't even patients that were reporting them to their board. It was their board actually filing fake complaints. We've seen that with another doctors, especially in the last 5 or 6 years, doctors that were using a lot of ivermectin or hydroxychloroquine or IV vitamin C treatments for, for the virus. But, it's probably not going to accomplish much. I wouldn't say waste any time and energy and anger on yourself, right? Sometimes it's just best to move on, knowing that another doctor that doesn't have the same philosophy as you is not going to agree with you, and they've been trained to think that way. So you're not going to change their minds. And they treated you bad. If they treat you bad, just move on. That would be my advice. Just move on and let it go. It doesn't serve anyone to hold on to that anger. And people that want to see traditional GI doctors are going to. They're going to see them regardless of your experience. And people that don't and want to see more alternative or natural or kind of take care of themselves by getting educated, those people are going to do those things and avoid doctors. So I think at the end of the day, take care of yourself and make yourself better, make your health better, and you'll shine a brighter light to other people that also need help in the world. What's your opinion on taking borax as a supplement for boron? I don't have any experience with using borax. It's not something I generally would recommend, Karen, simply because the company that makes borax, they're not making it for ingestible use. And so if there's a potential possibility that in their manufacturing process that you get contamination of certain things that aren't so great for you, that's not, to me, that's not worth the risk. If you want to use supplemental boron, use supplemental boron. And I know a lot of people are out there, recommending use of borax, but it's not a controlled product. And, to me, it's not designed to be orally taken. It's designed to wash your clothes or sprinkle around your house as an insect repellent, but it's not designed to take as a boron supplement. For a friend with severe low back pain, multiple surgeries, 2 bulging discs, pinched nerve from hip muscles, and she doesn't want to use narcotics. She's addicted to moringa. Is this a good option? Is there a better option? There's a lot of better options. I mean, for disc treatment, if she's had, I don't know what kinds of surgeries. There's a lot of nuance to that because there's a lot of different types of surgeries, and some surgeries would be contraindicated for certain types of treatment post-surgically. But if she's got bulging disc and a pinched nerve and she's not fused, then she might just want to consider seeing a really fantastic chiropractor with a good reputation. As far as other treatments, there's plenty of things that can help with pain. Sometimes that lower back pain is caused by the diet. You get the wrong foods in the diet creating inflammation. And it doesn't matter what kind of surgery you have or what kind of treatment you have, it's the diet driving the inflammation. So that has to be changed. So my opinion, the better option would be to get her turned on to no grain, no pain. I see a lot of people that, of the eve of surgery, like they've been following my book and doing it well for a couple of months. Their surgery scheduled very soon, and they end up opting out of the surgery because diet change dramatically improved their outcome, and they didn't need the surgery anymore. So there's that to consider. How is lupus diagnosed and how is it treated? Usually it's diagnosed by a rheumatologist. There's certain tests like there's certain DNA and antibody tests that can be done that are basically antibody tests, autoimmune antibody tests. And it's also a subjective diagnosis as well based on symptoms. So the combination of certain lab tests that measure certain antibodies combined with subjective symptoms of the patient's presentation. And generally it's treated with immunosuppression, usually depending on the person, depending on the aggressive nature or how severe their symptoms are. But the biologics have become a more and more favorite treatment of rheumatologists over the last 5 years or so. But now, my opinion of the diagnosis of lupus is that lupus is, like many other autoimmune diseases, just a manifestation of 4 triggers that a person has yet to identify: food reactions, chemical exposure reactions, nutritional deficiencies, and microbial imbalances. If a person understands those 4 categorical triggers about themselves, then you know, and applies it, then the autoimmune process itself calms down, and in many cases goes away altogether. So I would encourage you to encourage your friend to look through or look into those things if she's got lupus. What doctor do you recommend for HRT for your wife? Any good doctor that has good reputation and experience for prescribing HRT, hormone replacement therapy. I would look at biological hormone replacement therapy, but most of the doctors that kind of convert to that more natural alternative realm of HRT prescription are OB-GYNs, at least in my experience. So there's lots of them out there. I just seek one that has a good reputation. What are your thoughts on taking cayenne pepper and hawthorn for blood pressure? I think they're fine, but I don't think they're going to cure the blood pressure problem. So those have medicinal benefits, if you will, on the blood pressure. Cayenne can kind of thin the blood, which can reduce blood viscosity, and hawthorn has a medicinal benefit for lowering pressure. But ultimately, neither one of those things are fixing the reason the blood pressure elevates in the first place. But they're certainly okay to use naturally, temporarily, as the person is exploring the root cause of why their blood pressure is elevated. Does it work to take 2 tablespoons of raw organic sesame oil to lower blood pressure naturally? Does it work? I would say it would be touch and go, Laura. I would not put that at the top of the list of things that I would say prioritize for lowering blood pressure. My husband had a pacemaker put in on May 8th. Now his blood pressure runs up and down. His GP is concerned about the lows and the dangers of falling, etc. Best ways to make it stable. Eats veggies and pasture chicken. It's not enough information, really. I mean, he's got a pacemaker in, so his blood pressure's got ups and downs. I might have a concern there's an error in the surgery and the pacemaker maybe has a malfunction in it. That would be one thing to consider and talk to the doctor, the surgeon about. Beyond that, there's a lot of things that can affect blood pressure, as I mentioned already, and those things should be investigated if your husband's got a problem. There's not one thing that you're going to do that's a magic bullet that's going to make that stable, but there are many things that are modifiable that could. But in order to determine those things, he needs to get proper testing done. Food, chemicals, microbes, nutritional deficiencies are the 4 categorical triggers of inflammation, of which blood pressure is. It's a side effect of inflammation, blood pressure problems. My mother and her older sister both have had high blood pressure, and both have had dementia. Could any of the root causes of the high blood pressure be a cause of the dementia? Yes, because high blood pressure ultimately can lead to reduced blood flow to the brain, and that leads to increased oxygen deprivation and damage to brain cells, leading to memory loss and cognitive decline. So certainly blood pressure plays a role. People with higher blood pressure are at increased risk for the development of dementia. So determining why that blood pressure is high becomes the primary goal if you're trying to get to the dementia, if the dementia is vascular. There are other reasons for dementia as well, but blood pressure certainly could be one. What about essential intractable hypertension caused by malnourished mother? I read a study about that. I was 6th of 6 in 10 years, and my mother was hungry. Yeah, just because your mom was malnourished when she was pregnant with you doesn't mean that you have permanently abnormal blood pressure problems. You've got you may have been born malnourished, and you may have been malnourished through a big chunk of your life, maybe even yet today. But that's what I would encourage you to do, is figure out, where those deficits are and what you can start doing about them. Ronald's asking about the causation of high blood pressure from chronic kidney disease. Yes, your kidneys failing or not working properly can contribute to high blood pressure. And vice versa, high blood pressure can contribute to chronic kidney disease. It's kind of a back and forth door swinging both ways. My experience, Ronald, for a lot of people with chronic kidney disease is their diet is driving it. And one of the biggest drivers of chronic kidney damage is gluten. gluten. So if you haven't checked out No Grain, No Pain, I'd encourage you to read the book and follow the 30-day diet plan within the book and monitor your kidney function, or ask your doctor to monitor your kidney function. We've seen cases of people's GFR improving tremendously as a result of diet change. What causes bones not to make red blood cells? That's Holt on TikTok, Teresa Holt. Some of the simplest things, Teresa, are B vitamin deficiencies: vitamin B12 deficiency, folate deficiency, zinc deficiency. Those three nutrients particularly help stimulate the bone marrow to generate red blood cells. So a lot of times we'll see a red blood cell anemia. So somebody's has a low red count, and they've gone to their hematologist and ruled out any type of bone marrow cancers and that kind of thing. You've really got to start looking at B vitamins and zinc as triggers for something like that. Okay, so what does it mean if you take blood pressure at a doctor's office and it's always high, but at home it's normal? It means you have white coat syndrome. Very real entity. White coat syndrome is people get nervous going to see a doctor. And when you're nervous, your anxiety is higher. That generally what happens as a consequence of that nervousness is you're making more adrenaline and noradrenaline. These are the stress hormones. And they drive up your heart rate and your pulse and your blood pressure. So if you're in the doctor's office and you're nervous about doctors, as a general rule of thumb, many people are, your blood pressure could be higher. Now, there's another caveat to that too. A lot of times when you go into the doctor's office, they take your blood pressure the proper way. They take it improperly. And I see this all the time. I used to train when I taught in the university. I would train the nurses how to properly take blood pressure. And a lot of them coming into the class they were doing it completely wrong. And I've even seen this in hospitals when I'm advocating for patients, and I'll go in and I'll watch the staff come in, the assistants, the nurses, take the blood pressure. And it's like they're not positioning the patient properly. So there's an art to that. I actually have a video. If we could pull up that video on how to properly take blood pressure, you should watch this video so that you could get a great understanding of the proper. So 1, you have to be at rest. 2, you have to be seated properly. 3, you want to take it in your left arm. 4, your left arm needs to be at the level of your heart at rest, resting on something level. And you want to take it away from consumption of caffeine or other stimulants so that you get a true read for what your resting blood pressure is. Remember that blood pressure numbers are based on resting numbers. They're not based on you walking through a doctor's office and then getting your blood pressure immediately taken. They're based on resting. So you should be sitting for 3 to 5 minutes at rest before you make an attempt on blood pressure. And a lot of times in the doctor's office, they have you going from one room to the next, and then somebody immediately comes in and they don't position you properly, then they proceed to take your blood pressure. And so you get a blood pressure that's 5 to 10 points higher, and now they want to put you on medicine. And with the new guidelines, what they're calling pre-hypertension, which in my opinion is nonsense, there's no such thing as pre-hypertension. Anything above 140 on the top, anything above 90 on the bottom, technically considered hypertension. But for the diagnosis, you should have 3 consecutive visits to the doctor showing that your blood pressure is high 3 consecutive times in a row on those visits. Now, if you're taking it at home and it's super normal or low, you need to jot that down, keep a little log so that next time you go visit your doctor and they say, oh, your blood pressure is high, I want to put you on medicine, say, I thought you would say that, doc. Now, I've been logging it at home and here are my numbers. They're always normal at home, but when I come into the office, they're always high. So, then your doctor's going to understand you probably do have white coat syndrome, and he's not going to want to put you on medicine for that, because that, any good, smart doctor knows that's a reality. Let's see, doctor, my works construction in 100. Okay, so I work construction in 100-degree temp weather, can't sleep, bad dreams, overthinks, that keeps him awake, and can't come to climax, body gets sore and has to stop. What are issues we should be looking into? I'm not sure if you mean, so if you're talking about somebody else, you're talking about yourself. So is this your husband that works in construction in hot weather and can't sleep and overthinks and is stressed out? It sounds like they're just stressed out. He's got to get looked at. I mean, there's a number of things. It's just not enough information there. I mean, 100-degree weather, how much is he sleeping? How much is he hydrating? How well does he eat beyond that? What time does he go to bed? Does he have, when that construction work, is he exposed to anything like asbestos or other things that could be potentially dangerous or detrimental, affecting his health in other ways? Like, there's just a lot to unwrap there. So, I mean, I'm sorry, I can't help you more than that. If somebody's sensitive to frankincense, would they also be allergic to boswellia? It depends. There's frankincense and incense, which, you can light those as those little things that burn slowly. And those have other ingredients beyond just the frankincense itself. So, I mean, a person could be allergic to what's burning more specifically than actually the boswellia. So it just depends. Do you have a list of ingredients that we need to avoid in skincare, hair products, and cosmetics in order to follow the no grain, no pain plan? So that if you look at the list of ingredients in no grain, no pain, that's the list of things you're going to avoid in skincare and hair products and cosmetics. It's the same list. We also have that list published at glutenfreesociety.org. If you go to our website there, you can find that same list. I don't know if we have a link to that list of ingredients to avoid on Gluten-Free Society. We can put that up as a link, but that's a good place to start. Olive leaf extract for hypertension. I mean, possibly olive leaf is a fantastic antibacterial, antifungal, and sometimes people do have candida overgrowth, fungal overgrowth, or gram-negative bacterial problems driving inflammation, contributing to blood pressure issues. In that regard, olive leaf, might be an effective thing to use, but I wouldn't use olive leaf as my top tier, my S tier choice for, something that's going to be a, consistent, effective way to lower blood pressure. I mean, the number one thing, if I had high blood pressure, the number one thing I would do, maybe we should answer it in this way. The number one thing I would do if I had high blood pressure is I would look at my diet first. And I would answer honestly, am I eating processed food? And I would eliminate all processed food immediately, because processed food is full of GMO. There's tons of sugar. There's hydrogenated fats that can cause a thickness or an increased viscosity of blood. The extra carbohydrate or sugars can also increase the viscosity of your blood. And that, when you increase blood viscosity, you increase pressure. Your heart has to work harder. So that's a real simple thing to do. Eat real food for a couple of weeks, monitor your blood pressure. For most people, it's going to come down. Most people. And it may not come down to normal, but it's going to come down. There's going to be a tangible, noticeable difference. The second thing that I would do is I would improve my endeavors toward activity and exercise. Why exercise? Because we see blood pressure lower when people start implementing, 2-minute exercise training programs. You can do 2-minute HIIT training, high intensity interval training, which would be kind of an example of that. Might be, do jumping jacks for 20 seconds, rest for 10 seconds, do jumping jacks for 20, rest for 10, and do that for 2 minutes, 20 on, 10 off. And then sit down and relax, and you're going to see the number immediately start to come down. And one of the reasons why exercise induces a lowering of blood pressure is that exercise induces nitric oxide production. Nitric oxide dilates blood vessels, and when you dilate blood vessels, you increase their circumference and you take pressure off of their walls. So exercise, one of the simplest ways to lower blood pressure. And most people today, they're sedentary, they're not working out. They dismiss this. Doctors will tell you diet and exercise out of one side of their mouth or face, and then on the other side, they're writing you 2 or 3 different prescriptions. And so what they're really saying is diet and exercise, wink, wink. Here's some prescriptions because I don't really believe in you, and I don't really believe that you have the ability to discipline yourself well enough to eat well and to exercise. So here's the crutch. And maybe that's out of compassion, but I'm a different belief, especially with socialized healthcare. You can't give people drugs that cost $100 a month for bad behavior. The first thing doctors should be required to do, in my opinion, is one, we should have gyms in doctors' offices or in hospitals. And that patient should be put on a prescription of exercise 3 times a week, 30 minutes a time, like as a period, before any kind of medication is allowed exercise prescription first, diet change prescription first, you'll save billions of dollars a year in direct medical care costs, but also in secondary costs, because hypertension causes other problems. I mean, it increases the risk for heart attacks and strokes. It increases the risk for kidney failure and diabetes and, a host of other problems. So start with the easiest things, diet change and exercise. And then beyond that, if I'm trying to use supplements, if I'm picking like top 3 supplements that I would use to lower blood pressure, one would be an omega-3 concentrated fish oil, EPA and DHA. It naturally regulates the viscosity of the blood, and those fats are essential, meaning if you're low in them, your body can't function properly. So you get the essentials first. And omega-3 is essential, and most people don't eat enough of it. Number 2, I would recommend a really high potent, good quality multivitamin with a B complex in it. You can use something like what we have, Ultra Nutrients, taking 4 of those a day because there's B's in there, but there's also other minerals that help with the maintenance of blood pressure. And most people are malnourished. And so that's just a good, simple thing that a person can do that's going to help them there, but also in other ways. And then number 3, I would consider magnesium. Again, those are the top 3 things I would consider right now, today, if you're looking at trying to get an impact on your blood pressure. Beyond that, it's nuance. There's all variety of different types of reasons and shapes and sizes and flavors of why a person might have a blood sugar or a blood pressure problem. And that, we'd want to try to determine that mainly through testing and through investigative questioning. Yeah, I agree. So many of the commentary, so many of us didn't know we were abusing ourselves, and that's true. I don't disagree. This isn't me trying to say you're all evil and bad and you're purposefully harming yourself. This is just simply, let's respect food and let's respect sunshine and exercise and sleep first. Let's have such a high regard and such a high respect for those behaviors that we quit lying to ourselves about the need for medication, or this, my dad had high blood pressure and I have it, and my aunt and uncles had it. Like, that's nonsense. It's a lifestyle issue. And if we respect lifestyle behaviors and lifestyle changes first, if doctors are trained in that way and they respect those things, and if all the doctors are saying that, then instead of demanding that their patients go on blood pressure medications, then you're going to change the social strata of the way people think about it. And once that happens, now people are actually being educated by their doctors. And guess what? Those parents that are being educated are going to raise kids, and they're going to raise their kids with that understanding. But today's world, we've raised a generation of kids that believe that eating Pop-Tarts for breakfast on the go is healthy. And that eating processed food and going to fast food, and that, Chick-fil-A is a healthy version of fast food, and it's all shit, excuse my language, but it's just the reality. And you have to overcome those social norms that are Alice in Wonderlandian like crazy, and start really educating yourself. So I get your frustration, and it's not your fault per se, but it is, because today there's not an excuse. When you have an illness or a problem, there's an infinite number, well, maybe not infinite, but there's a rather large number of resources at your fingertips with the advent of the internet, and doctors like myself being, amicable with their time and sharing and caring and giving information freely to people. Like, people don't have an excuse unless they just don't want the real answer. If your solution you're looking for is a passive pill in a bottle, you're never going to find a real answer. Anyway, rant over. Can SPMs be used in place of omega-3s? No, SPMs are not a better choice than omega-3. SPMs are a downstream byproduct of EPA and DHA, and although they do have anti-inflammatory properties and helping to resolve inflammation, you want before you get to SPM, you want the EPA and the DHA, because they also have functions around blood viscosity. So you want the omega-3 over the SPM for that. What type of magnesium should I use? There's several different types of magnesium. So if you're talking about blood pressure, I'm a little bit partial to something called Ultra MG. We have three different kinds of magnesium in that particular product, because some people react to different types of magnesium differently. I would say this: if you're taking magnesium oxide, you're wasting your money. I would say this: if you're taking pure magnesium citrate, it may cause diarrhea, so be careful there. But magnesium glycinate, magnesium taurate, magnesium threonate are all pretty good options overall. Keep in mind, magnesium threonate might make you a little sleepy. It gets past the blood-brain barrier. And so for some people that causes, them to relax a little too much, and then they want to go take a nap. But check out Ultra MG, Mike. You can go to glutenfreesociety.org and just type in Ultra MG and you can read more about it. Is a Wellchild exam with a naturopath all right and legal to do? Depends on what state you're in. Naturopaths in some states are licensed doctors and can do a Wellchild exam perfectly fine, perfectly legal. In other states, naturopaths don't have the scope and or the legality to be able to do that. Now, so it just depends on your jurisdiction where you live. That's another thing that needs to change, in my opinion. Allopathic medicine, MDs and DOs have far too long had a monopoly over healthcare, and what we really need to see is naturopaths and chiropractors, and even DPTs, doctors of physical therapy, nurse practitioners, and even in some cases, physicians' assistants, depending on the level of their training. But those groups are generally going to be a lot more proactive around diet and lifestyle change and around, what we call common sense approach. Because we've given carte blanche to MDDO for the past 50 years to have basically a blanket scope of practice. And those doctors, what have they done with that 50 years of monopolization? We aren't healthier. Our outcomes aren't better. We rank last of industrialized countries. And so it's obviously the outcome speaks for itself. It doesn't matter what all that political interest groups are saying or what all the fear mongers are saying. Look at the damn outcomes. The outcomes speak very, very loudly. Our health sucks, and it sucks because the people in charge of leading the health aren't smart enough to understand that diet and lifestyle are more important. Either they're not smart enough or they're greedy, and so they're making different recommendations to pad their pocketbooks instead of to help the people that have entrusted them in that sacred bond of doctor-patient relationship. And to me, if you've got doctors like that are padding their pocketbook, they need to get the hell out of the profession and let somebody who gives a damn come in and take over. Anyway, you can tell I feel pretty strongly about that. I had a bout of diverticulitis in December, perforated colon. I'm 39, male, recently lost 40 pounds on a very clean Mediterranean diet, no alcohol, no drug use. Recently gone into the hospital for pancreatitis with my light pace levels over 200. They're telling me the two things aren't related, but I was on antibiotics for over a month with diverticulitis. Yeah, antibiotics can contribute to pancreatitis. No doubt about it. There's plenty of research that backs that up. So they can be related. That doesn't mean that they are, but they definitely can be. Go back up. I'm 210 pounds and under 15% body fat. I exercise 4 to 5 times a week, and I'm very active. What could cause this? So, I mean, your pancreatitis could definitely be an antibiotic, but have you done gluten testing? Because, you've got inflammatory bowel disease plus a pancreatitis complication, and gluten is a trigger for both. It's probably one of the more common triggers for both. And if you haven't looked into that, I strongly would recommend that you do. The other thing, I don't know where you live, but mold can be a driving force behind inflammatory bowel disease and pancreatitis too. So if you've got mold in your environment, or if you live in a home where there's ever been water damage and maybe something, a room or the carpet or the house itself smells a little musty, like you want to look at those things and investigate those things. What can somebody do for tinnitus after a brain injury? If it's immediately after the brain injury, one of the best things that you can do with a head trauma is to take high-dose fish oil for several weeks, Lynn, anywhere from 6 to 8, and even in some cases up to 10 grams a day of something like Ultra Omega or Omega Max. And that's to make sure that blood flow is going to the brain to help heal and recover. There's a colleague of mine at the VA hospital who did research on this years ago in soldiers with head trauma, and they were using high doses of fish oil in those patients and finding much better outcomes from traumatic brain injury from TBIs. Let's see. Mage says, thanks to you, my blood pressure's around 105/68 after quitting grains, sugar and most carbs, age 64. I feel great now. Love it. Thanks for sharing your experience with diet change. It's that easy, folks. I mean, blood pressure is not rocket science, although there's a lot of mechanisms and it can be complex. You know, diet, exercise, a few supplements, choice supplements on the top three. And then beyond that, if you're not figuring it out, it may be a little bit more complicated, and go get some help. Find a good functional doc and get some good help. Let's see here. What can someone do? Okay, I answered that one. We can go down on that left side. Just walked out of doctor's office because of a rash and a recalled there. And I recalled there was a tick in the same spot the week prior. Along with this, all came very uncomfortable body aches and headache that have not gone away. I have unfortunately had no choice but to take Motrin for this around the clock so I can get to work still. Doc wants to put me on doxycycline and start it now before the results come back. I'm concerned that this is all coincidence and my candida is back. How long is it going to take for those results to come back? Because if it's a fresh tick bite, you know, those results should come back pretty quickly, and you should have an answer ideally within a few days. I mean, if you have an answer within a few days, you could probably wait a few days unless your health is in a dire strait. But it doesn't sound like it is, because you're using Motrin and still going to work. So, I mean, I probably personally, if it were me, I would wait on the result to get back so that I would have the confirmation, because Doxy is it's a powerful antibiotic, and you want to make sure that you're justified in using it. There is a virus going around right now that we're seeing a lot clinically in people where, headache is a big part of it, and muscle aches and pains and fatigue are a big part of it. So it may be a coincidence. You might have been bitten by a tick that didn't carry Lyme. And that taking an antibiotic for an extended period of time might hurt you in other ways. Remember, the number one side effect of an antibiotic is a yeast overgrowth, and yeast overgrowth can create a whole lot of problems as well. So anyway, I hope that helps you. My husband's on 4 blood pressure medications, and recently one of them got increased, and now he has started experiencing trembling, shaking in the arms, hands, legs. Can it be real? Yeah, absolutely. When you start adding multiple medications, Christina, we call that, there's a name for that. It's called polypharmacy. In my opinion, polypharmacy is dangerous. No drug is passed and approved by the FDA in multi-drug studies. All drugs that are approved for use, the research on those drugs are done single disease, single drug use studies. So, when for example, losartan is a common blood pressure medication. The FDA approved that drug, studying people with just blood pressure problems using only that drug. But now you take somebody that's got high blood pressure, they're also diabetic, they also have, whatever other medical history, and they're on 3 or 4 other medications, and now you're adding this drug. There's no safety data on multiple medications used for multiple diseases, and that's why polypharmacy is so unpredictable. And when you start mixing and matching medications, there's always going to be some type of potential residual side effect or synergism between the medicines that could contribute to problems. And trembling and shaking in the arms and hands, I don't know what blood pressure medicines he's on, but there are a lot of different classes. There's ACE inhibitors, beta blockers, there's diuretics, there's ARBs. All these different medicines have different mechanisms of action. And some of them, like as a classic example, the diuretics, like hydrochlorothiazide is a classic example that can cause vitamin B1 reduction. It reduces vitamin B1's uptake into cardiac cells. So your heart cells can't absorb vitamin B1. And when that happens, you can get neurological and cardiovascular consequences of B1 deficiency, which can lead to tremors and trembling and shaking. So that's just, again, one example. I don't know what medicines he's taking, but certainly it's a possibility. Can you address white coat syndrome? My home readings are good, but I think I did. We talked about that. Maybe this question came in after the fact or before. No, white coat syndrome is normal. A lot of people, Gloria, a lot of people have it. It's not, you're not at greater risk in the future If your blood pressure is high when you go visit your doctor, then, and if it's normal at home, it's just white coat syndrome. It's a temporary stress where your blood pressure is increasing on purpose to help you cope with the stress, but it doesn't necessarily increase your risk of future health problems. So if you've got white coat syndrome, but your blood pressure is otherwise normal, rest at peace, be at peace at night. Don't let that keep you awake and stressed out. What could cause several areas of neuropathy, and what to do, or what do you recommend? Depends on what kind of neuropathy and what several areas you're talking about. Hands and feet, which is the most common type of polyneuropathy presentation. I mean, there's a number of things that can cause that. There are food triggers. Well, oftentimes, Gene, we see gluten be a trigger for neuropathy. Sometimes it's B vitamin deficiencies, especially vitamin B12 and folate are very common cause of neuropathy. Vitamin B6 deficiency can also cause neuropathy. Vitamin B1 deficiency can cause neuropathy. So get a nutritional deficiency test. If if you've already seen a neurologist and there's no discernible reason that they can find where you have a physical compression of a nerve causing the nerve to malfunction, then now you have to look at biochemical causes of neuropathy. And biochemical causes are, predominantly are nutritional related, vitamin and mineral deficiencies that contribute to deterioration of the nerve itself, leading to abnormal sensations. So if you're interested, Gene, we have a test called an INA. It's intracellular nutrition analysis, and you can go to glutenfreesociety.org, and those are available. You can purchase one of those, and it might give you some better insight into nutritional relationships around your neuropathy. Could you please explain in detail how you heat your food? Jessica's asking if you can scroll down a little bit there. I mean, one way you can heat your food, one of the ways I like to heat my food is I have a space heater in my office. And so a lot of times I'll just take my lunch is always packed in a glass Tupperware, and I put it in front of my space heater, usually about 30 minutes before I'm ready to eat it. And I just let that natural airflow go over that glass. It heats that glass up and it warms up the food inside. But there are things that you can do. You can heat it up at home, when you're prepping it in the morning, and you can put it they make electric heater lunch boxes. So you just plug them in and they keep your food warm. So that's another option. At home, we use grills and a countertop. We use a convection countertop to heat. So tinnitus after a 2-year-old brain injury, you still might benefit from omega-3, but from there, I would look at nutritional deficiencies first, just getting tested to see, do you have any type of deficit that could be contributory to, dysfunction of the vestibulocochlear nerve. Which of the nutrients that you discussed lower blood pressure also can help lower heart rate? Magnesium can, omega-3s can, vitamin B1 can do that as well. So hopefully that's helpful for you. Do you recommend air fryers? You can use them, but I personally, we have one at home. In all honesty, we might use it twice a year. Not for any other reason than it's just not a convenient thing to use. I mean, we just prefer the oven and the stove and the grill as our primary ways of prepping food. But I don't think there's anything horrible about air fryers. It's just convection heat, basically. It's just a high-powered convection oven for the most part. I am extremely no grain, no pain diet complaint. How can I avoid weather-related occasional migraines? Well, if they're weather-related, so you're talking about like pressure storm changes that come in, Cheryl, I'm going to assume that's what you mean. and there's barometric pressure change that contributes to that, the migraine, or triggers it. Probably one of the best things to do is get a good chiropractor and have them assess your upper cervical spine, because a lot of times those weather changes come through and the pressure changes, and it creates nuanced change in the musculoskeletal connections between your upper cervical, your occiput, and your posterior neck muscles, and that can be treatable. And if you have an issue up there, if you have trigger points in that area, when the weather comes, it's like the icing on the cake of not goodness, right? So it's kind of like the straw that breaks the camel's back, but getting that investigated might be helpful for you. Let's see here. Yeah, here's a comment. I found chiropractic and PT amazing for addressing lower back issues. I think so. I mean, I'm a little biased there, but chiropractic and PT, I'd say probably some of the most underrated treatments for musculoskeletal complaints in the world. I mean, I know in the US, I think chiropractic serves less than 1% of the population. I mean, medicine has done its job well by creating unnecessary fear about a chiropractic adjustment. I mean, that's the whole thing, right? If you get on some of these pages and websites, you've got idiots that don't know what they're talking about saying that, yeah, that a chiropractic adjustment is going to stroke you out or break your neck. What's the risk? 1 in 3 million? Is that an actual risk, or is that like weak data that was, concocted up by the medical association to put fear into people? As a matter of fact, it's a really good book on the topic called Wilk versus the AMA. Wilk was a chiropractor in the 80s. He sued the American Medical Association, and he won. He proved that the AMA secretly had created false propaganda against chiropractors, massage therapists, acupuncturists, naturopaths, for the sole explicit purpose of creating a monopoly on healthcare. And so a lot of the stuff that you hear that scares people away from, going out after alternative therapies, which in my opinion, they're not alternative therapies. They should be mainstream therapies, and medicine should be the alternative. But that was all concocted, and that was proven in Wilk versus AMA. Is it okay to take all water soluble vitamins together? Yes. Tanya says this channel should have way more subscribers. We agree, Tanya. Share more. Sharing is caring, right? That's why we talk about the suppression and the obvious. Sometimes I speak too much, and I think the powers that run this platform don't like that. If I'm on losartan 25 a day, what can I do to get off of it? Well, start with those 3 things, Rico: diet change, exercise, and look at magnesium and a good multivitamin and a good fish oil. Start there first, and then monitor your pressure. And as your pressure is coming down, it will, if you do those things, it'll come down. Now you can have that conversation with your prescribing doctor to say, hey, let's maybe take me from 25 to the next lowest level, right? Let's adjust me down, and then titrate your way down and get off of it. That's the safest way to go about doing it, is to work with your doctor in that regard. But if your doctor's like, no, you'll never get off of it, then find another doctor who's willing to work with you. What are your thoughts on nicotine patches for health benefits? I mean, there can be benefits of nicotine, but it's a drug. And if you need to take a drug every day for the health benefits of the drug interacting with your own physiology, then you're doing other things wrong. And yes, nicotine can affect blood pressure. That's not to say there can't be medicinal benefits for it in the short term, but I think people oftentimes reach for things that have pharmacological effects in an attempt to minimize their poor quality of life. And then they forget to ask the deeper question, which is, why am I in this situation in the first place? What's the safest, fastest way to low? I think I answered that one. Methylene blue for blood pressure. Now, I wouldn't take methylene blue for anything, really. I wouldn't take it for blood pressure, though, either. How to stabilize our blood pressure. Yesterday was 134/74. Today was 160/75. mean, that's normal. So part of it depends on how you took it. You know, that top number can change dramatically. You could drive through traffic and that top number could go from 130 to 160. Your bottom number didn't really change. It changed from, you know, 74 to 75, which is very normal, by the way. But that top number can deviate dramatically based on how much stress you're under, whether you've exercised, based on what's going on in your life, based on whether you've been up and around and moving, based on whether even based on simple things like whether you're wearing a tight shirt that has a tight sleeve that kind of puts pressure on your arm. So I wouldn't say that you have a stability problem. I would say you probably just need to investigate how you're taking it when you're taking it. Now, if you're taking it the same way every day at rest, you know, that's a little bit different. Now you need to start looking at asking some deeper questions, but it doesn't sound like that to me. How much magnesium a day for a female? If you're talking about a therapeutic dose, anywhere from 600 to 1,000 milligrams is pretty safe, Court. And that's per day, 600 to 1,000 milligrams a day. You know, if you have a history of being sensitive to supplements, you might start lower, 200, and just kind of work your way up. Some people, not everyone, and this is really rather uncommon, but some people, when they take magnesium, it actually makes them sleepy. It makes them too calm, right? It just brings things down too low. So if you're one of those, you know, start on that lower level and work your way up. Alternatives for migraine beyond CBD and hemp, depending on what's causing it. I mean, CoQ10, magnesium, vitamin B1, vitamin B2, feverfew are all things that we know are migraine prophylactic. So if a migraine's coming on, you can take higher doses of those things, and a lot of times it stops the migraine. You could add B12 to that list as well. Could parasites be causing Parkinson's-like symptoms? Possibly, yes. Husband has a history of Crohn's with resection of the distal ileum, low iron panel. What's the best way to improve? Ferrous sulfate with C supplement and lots of red meat and liver, question mark. It's a good place to start. To get his iron up, iron-rich foods, liver is great, red meat is great, iron supplementation can be very helpful and effective. But part of the problem with that is that if he's had part of his distal ileum removed, that's a very important location for how iron is absorbed. So I would start with, probably in this case, with supplementation. You can use the vitamin C to help enhance absorption as well. Someone with chronic myeloid leukemia, any nutritional advice? No, they need to go get checked out. They need to go get a full workup done. You know, there's no magic trick. That's a very complex illness, and you don't want to mess around with it. It's not a DIY project, in my opinion. I need to get my gut tested. What's a good microbiome test? Generally, Lynn, it's called Malditoff, Malditof. It's a form of mass spec, laser-assisted mass spec. A lot of the microbiome tests that people are selling online are PCR tests, so don't recommend them. They're non-diagnostic. They're great for epidemiological study data, but not super effective if you're trying to really understand if you've got a dysbiosis. Was diagnosed with gluten sensitivity. I assume you mean practitioner used IgGF-79, recommended immunotherapy, which is basically 1 injection a week for 1 year. Your thoughts? There's no way in hell I would ever inject myself with a substance once a week to help my immune system without first changing my diet, my lifestyle, and everything else I was doing, and getting proper testing. Anytime you bypass the gut as a means to put something in the body, you are bypassing 70% of your immune system, and you're trusting that whoever produced what's in that vial you're trusting them implicitly with the sanctity of your blood. So I don't like needles going in me that contain anything that could put something in me that I don't want there. And you can't take it back. Once, if you have a side effect and it's not good, you don't get to take that kind of thing back. Your body, may recover okay, but anytime that's why I like oral supplementation over IV. A lot of doctors want to inject vitamins or do IV and do IV vitamins, but I'm not a fan. I think nutrition comes through the gut. Things enter the body through the gut or through the lungs, the air. And bypassing that, you're bypassing the vast majority of your immune system and making yourself so susceptible to whatever's in there. And if it's not what you needed, or if it's something that you react to, anyway, I hope that's helpful. I just don't trust a lot of these companies that make some of these medications and other injectables. It's just not, I've lost a lot of trust in the system that we had. Let's see here. Keep the CPAP machine or have my tonsils removed? That's a big question. I mean, I'd say, why do you need a CPAP? I know why you're using the CPAP. You've probably been diagnosed with sleep apnea, but so ask the deeper question, William. What's driving the sleep apnea? For many people, it's chronic mouth breathing caused by chronic inflammation, caused by bad food or environmental antigens. And so investigating food as a potential trigger, environmental air quality in your home would be a good place to start. But ripping out your tonsils, that's where I would personally draw the line. Nobody's getting my tonsils, they're mine, and they have a function. And doctors can tell you all day long that you can live without them, and you can also live without your hand, and you can live without a foot, and you can live without a kidney, but I'm not going to let anybody remove those either. I was getting low blood pressure, 99/48 and 97/52, and have hypothyroid, high hemoglobin. Started taking electrolytes and started to feel better. Should I do something else to improve? You can get some testing done to see if there's anything else that you're missing. Food, chemicals, microbes, nutritional deficiencies are all great places to start. Again, it's some questions that are coming through about low blood pressure. And I'd say if you're asymptomatic, but your blood pressure is just low, 100/60 is not low blood pressure, by the way. It's normal blood pressure. But in today's day and age where everybody's overweight and obese, it seems low compared to a morbidly obese population. So unless your blood pressure's 100/60 and you're falling down, tired, dizzy, with POTS-like presentations, then I wouldn't call it low blood pressure. My blood pressure's lower than that. And, again, if you're healthy, it wouldn't be a concern. Let's see here. Yeah, electrolytes. If your blood pressure is low and you are symptomatic, the very first thing I would consider doing is add electrolytes to every glass of water that you drink. Put a good, healthy electrolyte in it and see about getting your salt up, because that's going to improve your blood volume, and that by default is going to increase your pressure. Just think of it as like the opposite of a diuretic. And diuretics cause you to lose water. Salt causes you to retain more water. And if you're underhydrated and your blood volume's low, you can develop low blood pressure and become symptomatic. Is raw cocoa with Celtic gray sea salt an adequate food source to make? No, it's not going to correct a magnesium deficiency. I wouldn't use it as a food source. You can use it as a source of magnesium, but if you've got a magnesium deficiency, it's probably not going to be super effective. I'd say from a food source perspective, probably pumpkin seed would be a better option if you're after the magnesium. Whole food exercise 3 or 4 times a week, no drink, no smoke, no grains, taking good vitamins every day, not sure why blood pressure is still high. Yeah, I mean, you could have a food allergy. Food allergies drive up blood pressure. There could be a food reaction that you have, even if you're grain-free and you eat relatively whole food and relatively well, it could be something that you're eating that is driving up your adrenaline, causing your pressure to go up. You could have an electrolyte imbalance, so check out, we mentioned that a minute ago, check out electrolytes as a potential as well. But beyond that, get tested. Micronutrients, there's plenty of them that can elevate your blood pressure, and they're not always super obvious. And it's in many cases, you've got 4, 5, or 6 deficiencies that are all convening together to create a blood pressure problem. Let's see here. Go down just a little bit. Get drug commercials off TV. I agree. I think that needs to go. Especially the models and the actors that are dancing around with smiles as if, I see polypharmacy cases all the time, and those people aren't smiling and dancing. Those people are miserable. They're in wheelchairs. They use walkers. They're overweight. They hurt. The last thing they're doing is dancing around on a TV commercial. Those things, to me, that should be false advertising. You should, kind of like the cartoon characters they aimed at kids, the Tricks Rabbit and all the other Lucky Charms nonsense that get kids, thinking that, cereal is a part of a daily balanced breakfast. It's no different with these drug commercials. Marketing is very powerful. Can calcium channel blockers cause headache pain? Yes. And eye pain? Yes. My mom's on several meds for lowering her BP, but no success. She's on ACE and beta blocker, ACE inhibitors and beta blockers, but the calcium plus the calcium blockers. Yeah, I mean, absolutely can. The line of questioning there, Nancy, would be, did the headaches start after the onset of use of blood pressure medication? Because if that answer is yes, now you kind of can track back and, have her have that conversation with her doctor. Yeah, I like that. Misty says, test, don't guess. Nutrient testing is amazing. I agree. Thank you. Just saw it. Let's see, logged in early. No. Can you touch on the connection of autoimmune disease and childhood trauma? I mean, there's a lot there to unpack, Dahlia. I would say this. I mean, trauma certainly can play a role in the development or the pervasiveness of autoimmunity. I'd say, and different people deal with trauma differently. The worst thing a person can do is be stuck in the past. When you're stuck in the past, there can be no future. When you're stuck there reliving your trauma. People relive their trauma by holding that in their heart and not letting it go, right? It was one of the tenets of Christianity is in spirituality is forgiveness. And I think a lot of people continue to have persistent trauma because they've yet to explore that path because it's hard to hold on to anger, and it's hard to hold on to resentment that you've had for somebody who's wronged you. And that holding on to that kind of energy pathologically definitely can fuel illness and fuel disease. And I think a lot of people repeat that pattern. And there's a lot of different ways to overcome that. But I think the first is just to recognize that it can be an issue. You should go listen to the interview I did with Dr. Sina McCullough, where we talked about that very thing, childhood trauma, and that was her last stage of healing from autoimmune disease was to understand that trauma and to reach a place where she could have forgiveness. And so I think for many that was a very powerful interview that might provide some insight on that topic for you. Is sourdough bread okay? No, not if you're gluten sensitive, Sonia. If you're, if you don't have a problem with gluten, it's fine. Provided the type of, the type of flour that you're using isn't GMO or hybridized or loaded with pesticide. But if you're gluten sensitive, sourdough bread, it reduces the gluten content. We do have research showing that it definitely brings the gluten content down, but it does not bring it down to a safe level for people that have gluten sensitivity. So, if you're gluten sensitive, it's not recommended. Do you distinguish between occipital neuralgia and migraine? Yes, you can. I get both, fortunately, rarely, but I know which is which. Yeah, I mean, you definitely, that's part of the differential diagnosis of the doctor who's doing the workup on you. So, to differentiate, the why, right? The trigger factors. Concerned about how I could be deficient in vitamin D when I spend a lot of time outside. Was told I am lactose intolerant, but the food test didn't show sensitivity to dairy. Lactose intolerant and dairy sensitivity aren't the same thing, Mary. So let me explain. We'll get to both of those questions. So one is lactose intolerance means you do not produce enough of the enzyme lactase. Lactase is an enzyme made in your intestine that helps you break down lactose. Lactose is the name of the sugar found in dairy and milk. Many people are lactose intolerant that are not dairy sensitive, meaning dairy sensitivity is a different response. A sensitivity is an immunological response. Typically in immunology, we have 4 classes of immune responses. We have types 1, 2, 3, and 4. Dairy sensitivity is typically what we call a type 4 immune response, where you are producing antibodies to that dairy and then presenting that dairy to the immune system. And then there's a secondary response from there where you have usually some type of T cell is creating either a chemical byproduct that creates inflammation. But a sensitivity is an inflammatory immune response. An intolerance is an inability to digest. So a food sensitivity test is not going to detect intolerances. They're not the same thing, and that's why there's that differentiation. The question about vitamin D is you can spend a lot of time outside in the sun. Oftentimes the people that are deficient in vitamin D are deficient in vitamin D because they have chronic inflammation. And the more you have chronic inflammation, the more vitamin D your body will use to protect you from that chronic inflammation. Vitamin D has immunological effects, immune balancing effects, and anti-inflammatory effects. So if you're inflamed, you use more vitamin D up. So the sun may not be providing enough because of the pre-existing inflammation. I don't know what your situation is specifically, but that is a very, very common reason why people who spend a lot of time in the sun still have vitamin D deficiencies. What about, okay, I think I answered. Nicotine patches for spike. I prefer for spike, if we're talking about spike, I like N-acetylcysteine and I like proteolytic enzymes, because proteolytic enzymes are something your body can make and break down relatively easy, and there's not a pharmacological effect or side effect risk over time. NAC I like because it's a natural amino acid, and there's good research on it with spike. Do you think nutritional yeast is bad for the body? I personally don't use it, not a fan of it. I think people could get away with it, but I see a lot of people with gluten sensitivity having cross reactivity to nutritional yeast, and so it's one of the reasons I don't recommend it. We know that candida is a type of yeast, produces hyphal wall elements or hyphal wall proteins that can look like gluten. So again, going back to if you're gluten sensitive or not, it's certainly something I don't recommend for those of you with a gluten reaction. I can't get my diastolic under 100 for over a decade. I take magnesium already, and I did your nutrient assay. What else should I add specifically for diastolic? If you haven't added exercise, that needs to be on the top priority for you. Are you overweight? Do you need to lose weight? For every pound of fat, you have to grow a mile or so of blood vessel to feed that pound, and that increases pressure. Are you, because if you've done nutritional testing, now you want to look at food. You want to investigate whether or not you have any food sensitivities or food reactions. Are you overweight? Are you sleeping well? Are you under tremendous amounts of stress, Misty? It looks like, I don't know, you're using the delineation RN behind your name. I don't know if you're a registered nurse. I assume that's what that means, but I know a lot of really great nurses who work really late hours or night shifts, and they're stressed to the max because their circadian rhythms are off, or because they just care so much about their patients that that stress is hitting them. So I don't know if that's you, but I see that a lot in healthcare workers, especially in urgent care types of situations where the stress usually is urgent and high. Nutritional things for myeloid leukemia for somebody who's already under care. Yeah, I mean, the best thing to do if you've got that kind of a diagnosis is diet change and testing. It's a cancer. You don't want to mess around with it. You can be under care, but get appropriate testing for food and chemical exposures and microbial problems and nutritional deficits, and then accordingly take action. So Anne is asking a follow-up on the iron question with the resected ileum. 65 milligrams of elemental iron. I start with one. Iron can constipate, and for some, it can make them pretty upset. So it's always better with iron. It's one of those, start with a lower dose and work your way up, and then get your blood drawn after about a month and just see how it's affecting or impacting it. Let's see. Have you ever seen low blood pressure be caused by progesterone deficiency? I recently read that could be a thing. I haven't seen it, but I mean, that I'm not going to say that it couldn't be a potential. Progesterone is a very important precursor to cortisol, which is cortisol is one of your main stress hormones. It has blood viscosity regulating effects and inflammatory regulating effects. So I guess in theory it's a possibility, but I haven't seen it. I was wondering about quercetin. Is it absolutely necessary to push zinc into the cell? No, it helps. It helps get zinc into the cell more efficiently. So if you're trying to supplement zinc, and in cases what we see, Ryan, is people are supplementing with zinc and their levels aren't coming up, and now we might add quercetin into that equation to get better absorption. But it's not a necessity. Any counsel for arrhythmia? Yeah, I mean, electrolytes, magnesium, potassium, chloride, calcium, get those things measured. Gluten can drive arrhythmias, mold can drive arrhythmias, environmental air quality issues can drive arrhythmias, excessive stress can drive arrhythmias. Your heart's an electric organ, right? Technically it's the third largest nervous system in the body. Your brain, your central nervous system is number one. Your gut is number two. You have more neurons in your gut than you have in your spinal cord. And then your heart is number three. So it's a very large nervous system affected by electrolytes specifically, right? Electrolytes are what drive nerves to function properly. So anytime you have an electrical disturbance, which is what an arrhythmia is, you really want to investigate that area. Does an induction hot plate harm the body? No. Not unless you're putting the body directly. Well, an induction won't hurt you. You can touch an induction oven; it works on magnetism, but no, there's no harm directly to the body. My husband stopped BP meds since his pacemaker was implanted 7 weeks ago. Fastest ways for him to reverse the cognitive decline he suffered from hypertension. I'd look at B vitamins and omega-3 first, Laura, especially if he was on BP meds, because BP meds, although they do lower pressure, they reduce B vitamins, and B vitamin deficits contribute to cognitive decline. So just based on that, I would start there. What to do for an aorta? So you have a dilated aorta. Is that what I'm understanding? Because if that's the case, you got to figure out what's causing a weakening or weakening, of your arteries. That's that generally one of the things that can do that is lack of protein or collagen deficiency, vitamin C deficiency, copper deficiency, because that collagen that forms the integral lining of your blood vessel, if it's not strong, you're going to get dilations in those blood vessels. And so you can get a tortuous or a dilated aorta or any other artery for that matter. Okay, go down just a little bit for me there. Do we have any more on the left, far left? Okay, covered that one. Red light therapies, what are your thoughts? I like them. My favorite red light therapy in the world is the sun. Go out in the sun on a regular basis. It's free red light therapy. But I do use a red light. I have a red light I use in the winter months when the sun's a little more scarce. But it depends on what you're asking about it for. I mean, as a general rule of thumb, it increases energy production, and so it can have profound impacts for people's just overall energy. But there are other uses of red light. It can accelerate healing in the skin. If you have a skin wound, it can, they're now doing research on red light therapy to improve vision from age-related vision loss, etc. So there's ample benefits of light therapy. You should check out, Wiley, you should check out my Light as Medicine crash course, where we do a deeper dive into a lot of light components. Blood pressure, 20 years, high, 160/90. I'm 61, female, fit. I eat healthy. I quit sugar in January. That's good. And lessen my carbohydrate intake. Doctors want to put me on medication, but I don't want to. I mean, it's not astronomically high, but it is a little high. I'd go back and watch my video on how to properly take your pressure and make sure it's being measured right. But if you're trying to lower it, watch Tuesday's class. There's some insight there. I mean, the other thing I would encourage you to do is get your nutrition levels tested. How is creatine's relation to blood pressure? Is there any benefit or any kind? I mean, creatine's main benefit is there's newer studies showing that creatine improves cognitive function, but those are relatively new. But creatine's longer term research is on improving energy in the muscle. So if you're trying to exercise, creatine can be extremely beneficial. It can also be beneficial at increasing strength and muscle gains with physical activity. And remember, muscle does have a regulatory effect on blood pressure. So in that regard, if we're using it to improve your lean body mass, you're going to have a side effect benefit. Remember, watch my show too. I would recommend, if you haven't, on Muscle as Medicine, where we talk about myokines and the other chemicals that muscles produce that have regulatory effects on the cardiovascular system. So anything you can do to build muscle, in my book, is a smart play. Muscle mass is arguably the greatest and most accurate predictor of both quality of life as well as longevity. And there are exceptions to every rule, but if we're saying what's the thing that if you could measure simply without a bunch of fancy technology that would give you the best understanding of a potential person's outcome, it would be muscle mass to an extent. Does CoQ10 lower blood pressure? Yes, it can. CoQ10 research shows anywhere from 5 to 10 points. Quercetin, I think some studies show, anywhere from 5 to 8 points on the reduction of blood pressure. So yeah, there are definitely nutraceuticals that have blood pressure lowering effects, and research to back them in humans. And CoQ10 and quercetin are two that we have studied. How long after no grain, no pain diet will affect the blood pressure? I mean, it can take some time. It depends on what's causing your blood pressure to be high. But if gluten's playing a role in it, you're going to get a pretty quick impact within a few weeks. Brachial pruritus, so you got an armpit rash. How do you get rid of it? You figure out what's causing it. Are you allergic to your deodorant? Is there a chemical in your deodorant that's reacting in your skin? I would start there first. There's also something called, oftentimes it's misdiagnosed, but there's something called adenitis suppurativa, which is sometimes a misdiagnosed brachial pruritus. And that is very much, in my experience, a gluten autoimmune skin type reaction. So, Deborah, you might look at gluten sensitivity as well. Yeah, so the nurse, Misty, the nurse, night hospital charge nurse, I knew it. Super stressful, and that's it. That's it. You gotta get, I don't know. I know if you love your job, if you're like me, you love your job, you're not gonna quit it, but is it possible you can switch shifts, get a change of direction? I would encourage you to talk with your HR department and let them know what you're going through, and if you can get a day job, over the night job, that circadian change might improve your pressure. Before you go through all that, though, maybe take a week or two of vacation if you've got it banked, and switch your schedule to a daytime schedule. Go to bed at night and wake up, in the morning with the sun, and see, does that affect your blood pressure? Do you start noticing it come down? Because if it does, then the switch is worth it. And if it doesn't do anything, then you might reconsider. I know a lot of nurses I've talked to over the years love their nighttime job because it's less hustle and bustle than if they were there in the daytime. But anyway, that's speculative. Will nutritional doctor jobs be replaced by ChatGPT? I don't think so. With chat, I mean, we never know what technology is going to bring, but it's funny, ChatGPT, you could ask it questions about your health, and what ChatGPT can do is it can comb websites like mine, it can comb videos like mine and others, and it can coalesce all that data and information, and it can give you an amalgamated answer of what a lot of doctors like me might say or might think. But what ChatGPT can't do and will never replace is clinical experience. Being in front of a human, having a conversation, understanding empathy, bedside manner. Robots are never going to replace that kind of thing. Human to human connection is important. And I can sit across from somebody that I'm seeing and I can understand more about them because of the energy that I feel or because of the facial expressions that they're making. So, ChatGPT is not going to replace that human to human interaction. I think it's a great tool. I'm not scared of it as a technology. I know a lot of people are. I think like any tool, I mean, you could put guns in the same category. They're a tool and they can be used for good or bad. People can kill people with a weapon, but they can also protect and save somebody's life with it. And I think it's the same type of thing. I think technology is depends on the user's hands, the ones that's wielding it. Have I done a video on histamine issues? Yes, Diane, I have. Maybe we could put a link up for Diane on histamine. Tachycardia, but normal blood pressure. Electrolyte imbalance could do that. So too could B1 deficiency, vitamin B1. I've seen that a number of times. I like that. So somebody commented on the ChatGPT. Yeah, ChatGPT can give false information too. Like you can ask it for resources or references, and it can spit out fake things. So with ChatGPT, anybody that's relying on ChatGPT to do the work for them is my opinion, irresponsible. Where ChatGPT, I have found it to be very helpful is I ask it, I like it to be my research assistant, so I can send it on a quest to pull literature on any different given topic. And it saves me time, but then I go read the research and actually analyze it and take my knowledge and experience and extrapolate from it. But I would never ask a robot to do that. Yeah, I like that. Lita says, anyone watch Dr. Pimple Popper? I would put her out of business. I mean, we would get rid of most of those skin conditions with no grain, no pain. People don't realize the power of diet over the skin. It's just tremendous. Do you think, okay, so answered that one. Heavy metals, metal toxins causing higher low blood pressure. Yeah, specifically, I've seen lead in a number of cases drive up people's blood pressure. Lead damages the kidney. Of course, kidney has an impact on regulating blood pressure. So certainly anything that hurts or affects the kidney can affect blood pressure subsequently. So yeah, metals in that category for sure. Okay, I think we're over time. At any rate, I just want to say thank you for tuning in. I'm glad you're here. I'm glad you watch. I'm glad you're back. If you're new, welcome to the channel. Do me a favor. You can support us in 3 different ways. We don't do advertisers or sponsors, so we don't allow any kind of undue influence, helping us bring you bad information or biased information. My goal is only to help empower you and to lead you down the right track so that you can make better decisions about your diet and your lifestyle and your health and overcome your struggles. So there's a few things that you can do for us. Number one, come visit me at glutenfreesociety.org. We have a shop there. We have over 100 supplemental products that are gluten and grain-free of the highest quality. We also have lab testing that we offer there, nutritional deficiency and gluten sensitivity genetic testing. So if you are in the market for those things, we really appreciate your support. It's what keeps our lights on around here and allows me to be back week after week to, to provide you guys with information and not charge. Number two, you can share this information with somebody that you care about and love. We are highly censored. And so knowing that, the only way we're going to get around is word of mouth. So the only way the algorithm only works for us when you do. So we appreciate your sharing and caring and spreading the word and helping us save 100 million lives. And number three, if you'd like to visit with me, you can reach out to Origins Healthcare. We have a full service nutritional practice and 2 doctors. And if you're looking for direct one-on-one connection, you certainly can do that as well. So those are the ways you can support us. We appreciate you. I hope you have a fantastic weekend, and we'll be back again next week. We'll be here Tuesday for 6 p.m. Central Standard Time crash course, and back on Thursday for a live Q&A every Thursday at 12:30 Central Standard Time. Thanks so much and take care. Bye-bye.